A breakthrough blood test which could predict Alzheimer's risk years before symptoms begin has arrived in Sydney. And joining me to discuss this today is CEO of Neuroscience Research Australia, Professor Matthew Kiernan. Professor, thank you so much for your time. This is an extraordinary development. Can we start with how this test works?
So this is a blood test that can be organised by your general practitioner, and we now have a diagnostic platform that looks for the protein abnormalities that are present in the brain that cause Alzheimer's disease. So these are proteins called tau and amyloid, and we can detect them now in a blood test to help diagnose. So the accuracy is over 90%, which is similar to the gold standard now, which is a PET scan, so putting a ligand into the brain, or alternatively a lumbar puncture, looking for amyloid or tau in the fluid around the brain.
How could this change the course of things for an entire cohort of people? What does it mean in terms of diagnosing early and then being able to treat the disease?
Well, as a neurologist, it's often very hard to make a specific diagnosis. We know that the patient might have dementia or neurodegeneration, but is it Alzheimer's disease? Is it Lewy body dementia? Is it Parkinson's disease? And this often only becomes clear at a post-mortem examination, and we have a brain bank here at Neuro. What we'd like to do is have a specific final diagnosis for individuals, and that would allow them to access the most appropriate therapy. So we know that there are monoclonal antibody therapies now available for Alzheimer's disease. They're TGA approved and they're waiting reviews by the Pharmaceutical Benefits Advisory Committee. So having a specific diagnosis allows you to have specific focused therapy.
Would it be used sort of in isolation, or do you still need, several other measures to confirm a diagnosis? How will it work sort of from here on?
With time, it'll be a standalone test, but that's the importance of the partnership with Roche Diagnostics. We'll be accumulating values from patients all over Australia, and that will be then an application that goes to MSAC for Medicare approval. So it will be available for general practitioners across Australia.
Wow, well, an extraordinary development. What a breakthrough. Thank you so much, Professor Kiernan, for your time today. Really, really great stuff.